Let's bring our attention to the story of Rekha, a 12-year-old girl who is living with both her parents and a younger sibling. She was failing in several classes in school, and her family was in the process of looking new school due to her failing grades and difficulty getting along with her classmates. She had a history of having sadness and crying, increased appetite and overeating, had feelings of guilt, low self-concept, anxiety, irritability, insomnia, hopelessness, and difficulty concentrating. In addition, she presented difficulties in her interpersonal relationships, persistent negative thoughts about her appearance and scholastic abilities, and had frequent thoughts of suicide. After the assessment, we informed the parents that she has been suffering from major depressive disorder. As we have seen in the previous episode, we had gone through depression among children, teens, their signs and symptoms, and causes of depression. Welcome back to another episode of Connecting Pathways. As mentioned earlier, in this episode, we'll be discussing on the diagnosis of depression, treatment, and some of the ways to help yourself through depression. The first step in diagnosis involves a thorough medical examination and evaluation of the mental and cognitive processes. If required, laboratory tests could include liver or kidney disorders, anemia, or seizure disorders. The history will explore the child's symptoms as well as the developmental history. The family and social history, including any mental illness, and the school environment, all or any of which may produce chronic or overwhelming stress, should be elicited. There will be direct interviews with the child that may occur in variety of formats, including open-ended questions in young children. For infants and very young children, observations of play, parent-child interactions are evaluated. For teenagers, questions requiring more detailed answers will be asked and some of the psychological tests will be done. Now we are moving on to the treatment and management of depression. For the treatment, the healthcare provider may recommend counseling and medications. For counseling, they provide cognitive behavioral therapy. It's a form of psychotherapy that can treat depression in children. Cognitive behavioral therapy helps children learn to think more positively and manage negative behaviors. This therapy gives children tools to cope with depression in healthier ways. As per medications, the most common antidepressant medications for children are selective serotonin reuptake inhibitors. These medications increase the level of serotonin in the brain. Serotonin is a chemical that can help increase feelings of happiness and well-being. Use extra caution with antidepressants in children. Some children show no improvement with the medications or may even feel more depressed. If a healthcare provider recommends antidepressants, watch your child's conditions closely. Never allow your child to stop taking antidepressants suddenly. Doing so can cause serious side effects or make depression worse. Now we can see some of the ways to help yourself through depression. Engage yourself doing exercise. Take a 15 to 30 minutes walk every day, or you can dance, play sports, or stretch. Depression may not feel much like being active. Try to get yourself to do it anyway. If you need a push, ask your friend to accompany you. Getting in activities starts help boost your mood. Keep it going. Eat lots of food and drink plenty of water. What we eat can affect our mood and energy. So with depression, you need to be sure to eat right. Even if you are not hungry, eat something light and healthy. And don't forget to stay hydrated with loads of water. With depression, your creativity and sense of fun may seem blocked, but it can help to do things that get your creative juices flowing. So express yourself by doing painting, drawing, doodling, sewing, cooking, or baking. Write, dance, or compose music. Chat with a close and trustable friend. Play with a pet. Find something to laugh about. Do things that you can enjoy. Even a little, that helps turn depression around. Talk about some good things too. Try to turn your negative thoughts into more positive ones. This can help your mood become more positive. Depression affects a person's view of things. things can seem dismal, negative, and hopeless. To shift your view, make it a goal to notice 3 good things every day. The more you notice what's good, the more good you will notice. Start by making some changes to your lifestyle. Go to bed and get up at the same time every day. Try not to nap. Take all the distractions out of your bedroom. No computer, no TV, no mobile phones. In time, you may feel your sleep improves. Staying involved and having daily responsibilities can help counter depression. They ground you and give you a sense of accomplishment. With this, we have come to the end of this episode of Depression Among Children and Teens. We hope to see you on our next episode of Connecting Pathways. Thank you and stay tuned.